Hi, I'm Nayla Bonilla, and I'm a junior at Justice High School and a public health youth ambassador. During our broadcast today, we are going to talk about public health careers. We are joined by a very special guest, Rashmita Subedi, who is a project officer at the Health and Human Services Office of Minority Health, and someone who has been very involved in the Public Health Youth Ambassador Program. Rashmita, thank you for joining us today.
Thank you, Nayla, for having me.
Rashmita, can you tell me about what you do?
Thank you, Nayla, for the question. As you already mentioned, I'm a public health analyst and a project officer working in Office of Minority Health. So my day-to-day role as a project officer is to provide grant oversight, including Fairfax County, who is a grantee for Office of Minority Health. Besides that, if I go back to my previous job, I was a public health intern at SAMHSA, and SAMHSA stands for Substance Abuse and Mental Health Service Administration, where I worked in an office of behavioral health equity, and I got to learn a lot of projects that SAMHSA supports for substance use disorder for racial and ethnic minority populations.
Wow, that's really interesting. So, what would you say is the hardest part about what you do in your job?
That's a very interesting and interesting question. And the hardest part that I do about my job is to work in the programs that is specially geared towards changing health behavior. I think change is such a difficult um, case and difficult case throughout, not just in my profession, but I guess throughout different areas, different scope of healthcare industry. And my work as a public health analyst in Office of Minority Health, we work with populations who are marginalized communities and who are from racial and ethnic minorities. So I think changing healthcare behavior, I think that's really important as well as the difficult task to do. And that's where we rely on a lot of community-based interventions, community-based programs like this. And we are very thankful to have Fairfax County, who is very geared towards community specific needs. And they have proven that it is doable, and it is doable to change health behavior in those communities. And an excellent example is Public Health Youth Ambassador program. So I really, really applaud how far this program has gone, even if it's just in the infant milestone. This is the fourth cohort for Public Health Youth Ambassador, but we have seen tremendous amount of change that you have brought through this program. So my question would be to you, Nyla, um, that what inspired you to become a public health youth ambassador?
Well, I think for me, like what you said is just kind of what I want to go into and what inspired me to join this program. It was just seeing all the different aspects of health that I can be a part of and I can make a change. As a young student, like most of us feel like we don't have a voice in our communities or we can't really voice that change. And I think through the Youth Ambassador program, being able to join it really showed me that I have that superpower of I can make a change in my community. I have the resources. I was able to have those connections and knowing that people cared about that. So, hearing about your job experience and how you work through things is just amazing. And that's kind of what I want to lead into in the future. So, I know you explained a little bit of how your career began with you being an intern and everything, but would you tell me a little more about that process in your career?
Sure. So I have a long story to tell, but I'll cut it short. I feel like I have lived several lives. So I am an immigrant here in the United States. So I will talk about my pre-migration story. And I was born in Nepal, which is in South Asia, and I completed my bachelor's in science and nursing in Nepal. Moved to United States in my 20s. So I guess it's a good, you know, good thing about this is I can see perspective of both worlds, and that brings me to a point where I can think from a perspective where the healthcare delivery system is totally different, and it's an underdeveloped country versus living here in the United States. It's a developed country with a different healthcare system. So moving here and transitioning through my career had taught me a lot. And I will share a little bit of story. When I moved here, I was not a nurse. I was not working as a nurse, despite the fact that I work as a nurse in Nepal. I was not able to do that because there are a lot of protocols that you have to follow, and you have to go through extensive examination and likewise. So I moved with my family, and during that time, I need to support myself as well as my family, and I took different roles. And I'll just talk about the clinical roles that I take because it's very interesting. I took a role as critical care technician in a hospital in an ICU setting, also in a neuro setting, where I learn about health disparities, where I learn firsthand like how people living in the developed country like United States still experience disparity. In my mind, I thought that United States will be very different, and I will not experience disparity, right? But I saw firsthand how those patients have different chronic conditions, and how the patient with racial and ethnic minorities, or different social determinants of health regarding their housing or insurance, how different their life is, or how differently they are treated in the healthcare industry. And I got to learn firsthand during that critical care technician role at Sinai Hospital. That just sparked something in me to learn more about what disparity is about. And I shifted my career from nursing. I was trying to become a nurse here, but I shifted gear here. I applied for a master's in public health to learn about healthcare system, which I'm still learning about because it is very different from where I came from. So during that process, I did apply to Association of State Public Health Nutritionist Program, which was funded by CDC, and it was about heart disease prevention. And remember, I was working in neuro unit and ICU, so I had seen a lot of patients with a stroke, and their chronic conditions depended on them not sticking to the medication, blood pressure control medication. That's such a small thing you can do for yourself, but there are so many underlying factors that they didn't stick to the regimen, right? So I was very interested in heart disease prevention, so I applied to that internship, and I got that internship. And then while I was learning about it, I just applied for more internships so that I could, explore what many options are there in public health. So I did apply to through HACU, which is Hispanic Association of Colleges and University. They do have like various linkages to federal industry, federal public health industry, and that's where I got a secure internship at SAMHSA, which is Substance Abuse and Mental Health Service Administration, and that's where I, worked as an intern in the Office of Behavioral Health Equity, where I learned about substance use disorder. That's very, that's like an epidemic for so many racial and ethnic minority population. And I was able to work with amazing public health analysts there, and that's where I learned, oh, that position has so much potential of bringing change. So that's where I focused on. And after the internship, I landed here in Office of Minority Health. But besides landing to Office of Minority Health, I also did my side job as a medical interpreter, um, serving Nepali and Hindi speaking patient because I am very fluent in Nepali and Hindi language. So, talking about the medical interpreting part, I was doing it as a contractual interpreter, taking the assignment as I go whenever I had time, because that's I've been doing it for free for my friends, families, and especially my mom and dad. So I thought, oh, there's a way to make money. So let me take a role of medical interpretation. But um, jokes aside, it was a very good opportunity to spend time with my with Nepali and Hindi speaking clients, learning about their health behavior. It also, sparked that interest in health equity. So I know I shared, a lot of things here, but hopefully I answered the question.
No, it's perfect. Like, I mean, you answered like why you were attracted to public health, and I see that so much of it was like how you really interacted with your role and your career was through your cultural aspects, which is something that I also want to, bring about with the youth ambassador program, bring in my cultural beliefs and what I've learned through my culture, and I really that's amazing.
That's great.
So,
And Naila, I do want to ask you one question. This is something I experienced as an immigrant, immigrant person who came along with parents. But luckily, it was for me. I moved here in 20s. But what does it feel like when you have a role reversal in your family, or if you experience that in your family as well? The role reversal is the fact like you being the interpreter or you being taking the role of parents and providing support to your um, parents. So how does that turn out to be if you have
uh,
experienced that?
yeah, I mean, for me, it was really different because my mother, she really wanted to learn English. So I really didn't have that role in being an interpreter because she really wanted to have that independency of knowing that she can speak the language. And I really saw her like wanting to try, like she was always there trying to learn everything she could about the health system, being able to apply for Medicaid and like all these different aspects, and just seeing her be so resilient with that. I think I just saw I could step in and help her with those situations. So whenever she asked me about certain health forms or certain things that didn't make sense to her, I was there to go and tell her about that. Even though she knew how to speak, how she learned how to speak English, I was there to support her in, doing those things. So I think, I in some way I wasn't so much the interpreter, but I think just seeing my mom's hardship and my parents' hardship as coming here as immigrants and them sharing their stories really influenced me to want to build better health resources for the Latino community and underserved population. I mentioned that, in the introduction that I'm a public health youth ambassador. What stands out to you about this program?
Well, as I mentioned before, public health youth ambassador, it has so much potential. And as we talk about health literacy and this grant that OMH has provided about advancing health literacy to enhance equitable COVID-19 resources, this is specifically geared towards increasing, health literacy among the population in need. And that's what Fairfax's goals are as well. And it aligns so much well because it empowers within the community. It's not just about increasing health literacy, but it has touched so many other aspects of it. For example, the Public Health Youth Ambassador Program is empowering the youth to be health literate, right? And after talking with you, Nyla, I know that you are so like knowledgeable in so many health care needs that your community have, and I think this program will bring so much insight. And we talk about data analysis, the bigger picture, but sometimes we need those data points from within the community. And it's always done better when we have those data resources pulled from community, and that's where the community health workers come. And the program itself is certifying youth to become community health worker and bringing those valuable insights, what community needs, what are the health um, what are the health changes that we can implement. It just shapes the strategies we build at the federal level, state level, or even in the local government level. But not just that, it's opening up different doors, a lot of opportunities for the youth to become a public health professional. And that's what I'm very excited about. I do want to ask you one question. What do you aspire to become in the future? And, you know, how does the Public Health Youth Ambassador um, program uh, will help you to achieve that goal?
Yeah, so I think through the program, I mean, we learned so many different things, so many different aspects of health. And I think having that just really showed me what avenue I wanted to go to, because I was all over the place. I didn't know where I wanted to go in the future, with starting to apply for colleges, thinking about certain things. I think that's what the Youth Health Ambassador program all help you with, like kind of having a clearer path of what I wanted to do. And just through the projects as well, I kind of learned, what I feel my purpose could be, or I want to be in the future. And I'm really looking forward to majoring in public health, possibly with health administration, and kind of just being there to support individuals that that look like me, and that speak the same language as me, or like I want them to feel comfortable with someone that knows their situation and can help them through that. So I think that's a big part of what I want to aspire to be.
Awesome. And most of the time, I would say people say, don't be afraid of dreaming, but I would say don't be afraid of changing your dreams, because as the time passes, your dreams and aspiration can change. And like me, you might be in the stage where you feel like, oh, this dream is not serving my purpose, or you want to achieve something. And, we are living in a fast paced environment and everything is changing. The healthcare need changes, or the understanding of healthcare need changes, right? So always be open minded, and, just um, think of the things you want to do with your lives and make the decisions, and try to make the decisions, but also try to have the support that you can get, like the program itself. There is a community that's supporting you, so utilize that, and utilize all the resources you can get to pursue your dream.
What advice would you give to like youth that is considering to be in the health field?
That's an excellent question. So, from my perspective, as I mentioned before, there are a lot of careers in public health. It's not just, one profession. It has so many aspects to it. Don't be afraid to choose one particular field that you're interested in, but in the long run, while you're in the process of doing your job in that particular field, if you see something that sparks your passion. I think passion is the thing that you have to pursue, because that can lead to another scope or another area in public health profession. Keep learning about yourself, what your interests are. Make a note of it. where you, like, for example, in this public health youth ambassador program, you were given to choose a topic of interest, right? So similarly, keep developing that passion, and things that you want to do in your life, and try to choose a profession that suits you. But also at the same time, if it doesn't suit you, then don't be afraid to make a change.
Yes, I think that's advice that a lot of kids need, just knowing that they should go and drive for their passion. And I think that's amazing because, sometimes you have to think of the reality. Is this the right job for me? Is this the right career path that I want to take? And that's amazing. So, I mean, with your passion for your job, where do you see yourself in 5 years from now?
It's a very good question. And in 5 years, I want to continue what I'm doing because this job aligns with my dream and my passion. So making it my dream job. So I want to keep continuing what I'm doing, advocating for all the marginalized racial ethnic minority populations there, voicing the health equity and bringing some change in healthcare system. So I don't know what some changes would be, but I am very aspirational to see the waves of changes in healthcare system and making it equitable. The same
That's
question goes to you, Naila. What do you see yourself doing in 5 years?
I mean, for me, I'm gonna be in college. I aspire to continue serving my community wherever I go. Just being able to help, even if it's for a little bit. So I I see myself in 5 years just continuing doing the same work that I've been doing, just supporting my community in whichever way I can. Like you said, I want to find a way that I can help change the healthcare system in some way. Because I really aspire for that, trying to make it more accessible for certain communities. So that's what I aspire for in the near future. So thank you, Miss Rashmita, for joining me today in this talk. And I would like to say, if anybody's interested in the Youth Health Ambassador Program, please look in the Fairfax County website. Thanks again, Ms. Rashmita.
Thank you, Naila, for having me, and good luck with your future endeavors.
Thank you.